Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mum?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
Really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it.
Stop CPR.
He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
On this episode of Paramedics,
Just lay back, lay back.
Nicola and Risky are confronted with a bizarre accident that lands a driver on the rocks.
Bring your legs this way.
The car's travelled across multiple lanes of traffic at speed. She's obviously had a medical episode of some kind.
Neil, open your eyes.
Simon and Michaela try to work out why this 21-year-old has collapsed at work.
Open your eyes.
What's wrong?
My main concern is that it could be his brain, it could be his heart, or it could be drug-related.
Do you maybe want to gather a bit of a bag for the hospital? We're going to take her there, OK?
And a loving son fears for his mum's life.
My mum is my heart. She's my rock. She means everything to me.
It's good to be back together again, Risky.
It is good. Like time has not passed.
I know. It feels like let's pick up right where we left off.
I know.
Longtime partners Nicola and Risky are back on the road after 18 months apart.
I've missed ya.
I always enjoy my time. In pickle.
Back in the big smoke.
Yeah, I know.
Risky's one of my best mates, so to be able to work together and hang out and spend the day together is really fun. I'm excited about it.
A fair bit's changed. Yeah, you've got another baby.
Yep, that is true.
Hello.
Hey!
How you going? I thought I'd surprise you.
It's a nice surprise.
I know.
What are you doing?
It's great being back working with Nicola. The last time I saw her at work was when I brought little Eve in to meet her. But it's actually great now that I'm back off mat leave and we're actually working together again. That's my comfort coming to work knowing I'm working with you.
Yeah. So let's do this, eh?
Yep. RC 139.
You are now the closest car to Docklands for a road traffic accident. Patient on alert, road 031.
RC 139, receive code 1. So we've been dispatched to a traffic accident. 55-year-old female came across 2 lanes in a car, fluid leaking from the car, patient seizing. That's pretty serious.
Yeah.
Multiple things going on there. We've got a trauma with a medical condition. Heading to this job, our main concerns are why has she had the seizure? Does she have a history of seizures? Has she hit her head? Is there trauma to her and her body at the moment?
Obviously, we've got to check other people involved.
Yeah.
There's going to be a lot going on.
Due to the urgency of the case, 2 single responder MICA units have already been called to the scene.
So our MICA paramedics have a lot more skills than us and they've got a lot of other drugs that we don't carry, so we need their expertise in priority 0 situations. Oh, they're both there.
Yes. Jeepers. She's gone up the rocks.
Oh. Are you serious?
On the other side of the city, MICA paramedics Nathan and Jody are quickly realising they share a good love of food.
Had a really nice salad then.
Yeah.
I don't know, yeah, it was like chickpea and kale and like all healthy things, but it was actually delicious.
Good. Yeah, the food's actually not bad.
It's my favourite cafe for sure.
Yeah. In the ambulance, you don't get a lot of downtime, so you get enjoyment out of the little things. For me and Jody, food is of vital importance.
I got cookie all over me. I'm sorry, I think I just sprayed cookie on you. I'm so sorry.
No, you're good.
Snacks, that's where the action is at.
But the chit-chat is put on hold.
emergency services.
As a disturbing call for help comes through.
Okay, tell me exactly what's happened.
A guy just tried to kill himself.
All right.
We just heard a yell, and this gentleman just came out. He's quite apologetic. He said, "Oh, sorry, I just tried to kill myself. I ran through a window."
Okay.
He's bleeding from his head and his arm.
Is he awake?
He's awake, yeah.
Is he breathing?
Breathing, yes, yes. He's cut on his head, his forehead, and his wrist. He said he's been shot, but I don't think so.
Can we confirm he's been shot?
I don't think he has.
You don't think he has?
I don't think he has. He's sort of rambling a bit. I think there might be a bit delusionary there.
Okay, okay. I'm organising that help for you now.
So, we've been dispatched to a male patient who's bleeding from the head and the arm. He's run through a window. Gunshot to abdomen, caller has inquired, and nil guns present cannot explain how injury occurred. Recoded for possible scene safety. Patient has PTSD.
Yeah. We get a call for a patient who's got blood all over them, who's potentially been stabbed or has a gunshot. So, to myself and Jody, first concern is safety of the scene, and for us, we're not going to approach a scene where we could potentially be harmed. We need to make sure that we keep ourselves safe so we can help the patient as best we can.
There is the potential that he's not actually aware of his surrounds and what's going on, and it may be a contributing factor as to why the information that we've received is so
patchy.
varying.
Yeah.
Our concern is that this patient may be experiencing a psychotic episode, and as to whether he is injured, it's really hard to ascertain until we get eyes on the patient and we can physically assess him and talk to those around him to find out exactly what's happened. Hey, how are you?
Just lay back, it's all good.
Risky and Nicola have arrived at the scene of an unusual car accident on the side of a freeway near Melbourne city centre.
Can help you in the back if you like.
Come on. Nice and still for me. Nice and still. Just gonna put a collar on you.
Micah paramedics are trying to calm the disoriented 55-year-old female driver.
The car's travelled across multiple lanes of traffic at speed and launched onto the rocks, and it's pretty clear that she's obviously had a medical episode of some kind.
It looks like she's post-ictal.
Yeah.
A good chew on her tongue.
Yeah. We think the patient's post-ictal, which means she's had a seizure and now the seizure activity has stopped, but she's confused and not orientated. I might try and get the bed just as close as possible. I'm going to try and get it in there.
Yeah. Did anyone else get hit or anyone? No one else?
No one.
Okay, cool.
Witnesses rushed to the driver's aid and were able to rescue the patient's dogs, who seem uninjured.
The patient looks agitated. Micah trying to keep her C-spine protected, but it's really, really difficult to get her to do things that we need her to do for her own safety.
Hello, you okay? Bring your legs this way. Come on.
The paramedics must begin the delicate task of transferring the patient to a stretcher.
I can move the bed to here once we've got room.
When she's out of here, we're going to assess her.
Do it properly. Yeah, let's get her out.
It's really important for us to get her out of the car, to immobilise her spine, to prevent any further damage and any further movement.
Come on. Nice and still. It's all good.
But it's really difficult because you're basically talking to someone who's still moving around and not processing what you're saying.
She's behaving like she's got a head injury, so we need to be real careful.
Clear left. Yep.
Not far from Melbourne city centre, there's been a report of a non-fatal attempt at suicide. With conflicting details about what's happening on scene, Nathan and Jody have to consider their own safety.
We'll treat it as if there is weapons on scene, just for the safety component for us. There could be some significant cuts or lacerations to the patient. It says that he's run through a window. He could potentially have been shot, so he could be gravely unwell. So time will be of the essence if that is the case.
Yeah, absolutely.
Yeah.
So the plan is for Nathan to try and assess this patient outside of the ambulance, essentially to ensure our safety, the patient's safety and everyone around. Micah 30, we're just approaching scene now. We'll just assess and see how we go. How are you going, mate?
As we approach the scene, we see a man who appears agitated and he had blood all over his head and all over him as well.
G'day, Nathan's my name. Come and take a seat over here. What's happened today?
Mate, I got smashed through the window.
Which level?
Can you clean this, please?
Pardon?
Can you get a top skid? And can you please clean this off me?
Okay.
Or something.
Where is it? I want to help you.
The patient potentially seems like he's having a psychotic episode. He's actually jumped through a window rather than being shot or stabbed.
What level of the building were you?
Yeah, no, please, mate.
In the bottom level?
Oh, that one just there. Yeah.
Have you jumped off the balcony?
No.
No? So you've gone through the window? Can I have a bit of a look at your arms, mate?
We can see lots of blood, a laceration on his wrist as well, which was quite deep, and a little cut to his abdomen. Even though the cuts are small on the abdomen, sometimes they can be deep and potentially involve organs that are underneath that cut.
Okay, stay still for us. Not in the ambulance, mate. Yeah, we'll clean it for you.
You need to come out so we can clean it.
Do you want to sit down for us? Is that okay? I'm going to clean it for you. It's okay. Here we go. Pass me your hand. You're okay.
Look at me. You're safe.
It didn't happen before. I wasn't bleeding like that, mate.
You're safe. Okay, we are going to look after you.
Some of these things that he's telling me, it seems like he's delusional. He's lost the content of his thoughts and his processes.
Hey, can you check this again, please?
Absolutely. It looks fine. It's not bleeding.
It's a puncture load.
I know.
Maybe a dart. Hey.
You're okay. Just stay.
This was a poison dart. I'm going to pass out. Can I please fall over? I'm going to panic attack.
Okay. Breathe. Breathe. Everything's okay.
Squirt it. Squirt it. Squirt it. Keep burning. Squirt it. Clean it with the other side, please. Oh, see, right now. Please.
I think we should give you some medication that might probably help you to calm down.
If that's right.
Yeah.
Our approach to this is to treat the patient outside of the ambulance because once you're in the ambulance, it's quite a confined environment, and if someone does decide to escalate and become violent, you're really the only target for them, and that's an extremely unsafe situation to be in, particularly without police assistance.
I'm going to get the bed out. I'm going to get you to lay down on the bed, out of the car, and over here, and then we'll be able to patch you up. Okay? No.
Micah 30, we need to hurry up on police at the moment, please. He's escalating in terms of his behaviour.
Just popping some seatbelts on. Okay.
After helping remove a 55-year-old driver from her car, Risky and Nicola are now trying to calm the distressed patient.
Just try and lie still. Lie still, okay? We've got you.
They've said that she's come from over that intersection straight across here with no deceleration.
Yeah.
Probably unconscious for that.
The patient's behaviour is quite unusual. She's really emotional and distressed, so this increases the concern that she has a potential traumatic brain injury.
It's okay.
You're okay. Let's just try to get into a position of comfort.
Okay, I'll loosen it for you, sweetie. I'll loosen it. So the patient's still confused. She's still agitated from something that's gone on. We're going to continue trying to calm her down and reassure her because being post-ictal, it takes a while to regain full consciousness, so we need to keep trying.
Hello, my name's Matt. Bring your arm down. Hello, I'm Gavin. This is Gavin. Okay? You've been in a car accident, right? What's your name?
So both the Micah paramedics are in the back with the patient now because it's still unknown what's going on with her. It could be a simple seizure, but it could also be a bleed on her brain that could cause her to stop breathing. So we need their skills in case that happens.
I just got a little bit more story about...
Oh, yeah, yep.
So she's at the lights over here. The light's green. She's been stationary, even though the light was green. And then suddenly accelerated straight across the median street into these lanes, up that first lot of rocks into the air and landed where the car is there.
So whatever's happened has happened over there at the lights.
When I find out that this vehicle has gotten air, it indicates to me that the speed must have been quite high and the impact has been really significant. We need to be really careful because of the potential for a spinal cord injury, but also we don't know what other injuries may be present.
Ready?
Yeah, very, very, very gentle code 1.
Alrighty, we are going to help you, but I need you to stay still.
Not far from Melbourne city centre, Nathan and Jody are trying to treat an agitated man who says he attempted to end his life by running through a window.
Guys, could we just grab one of you to jump in the back with Nathan? He's just kind of climbed himself in there, so just to protect Nathan, thank you.
Before I patch you up, I'm going to put some dots on, blood pressure, all that kind of stuff, okay?
With police on scene, in case the situation turns violent, Nathan can now treat the patient inside the ambulance.
So what happened with you running out of the window? Was someone chasing you, or what's happened for you to go through the window?
I was attempted suicide.
Attempted suicide. Okay.
For me, it's always hard to hear of attempted suicide. To imagine someone's emotions getting to the point where that is the only option is really awful for that patient, and it must be a really deep hole for them. It must be torture to think that that's the only answer.
Lay down. Lay down.
Can I please have this officer out of here? I recognise that tattoo. Can you please get off? Just relax. Are you on another ambulance?
We're on other ambulances.
Where with this? Are you with the ambulance? Can I please come with you?
No, no.
Can I please come with you? Ketamine.
So this patient's behaviour has escalated and he launched himself on a colleague in quite a rapid fashion, which was extremely scary, essentially, to have someone behaving so erratically coming out at you.
If you relax, hey, if you relax, we'll be able to help you.
I need to go to the ambulance.
You're safe, okay? You're safe.
Spray my head.
What we're going to do is we're going to give you some medication to calm down, okay? Nice and still.
This isn't an overly pleasant process for anyone. It's particularly not nice for the patient. The patient doesn't have a grasp of what's going on and why we're holding him down.
Don't give me that injection unless you're from the ambulance.
Stay still, mate. Stay still.
So at this point, we've elected to administer sedation for this patient to ensure that he is going to be safe.
You're okay. You're all right, buddy. Just stay still for us, mate. You're doing really well, okay? There we go. You're okay, mate. Just stay nice and still for us, mate. You're doing really well. All right, so I'm just going to close the doors. We'll go to the side. You're okay. Just stay nice and still for us, buddy. You're in a safe place. You're in the ambulance, okay?
We've assessed the patient and essentially found that his primary injury is a laceration on his head. So now that we've done this, we'll be able to safely transport him to the hospital with the assistance of Victoria Police.
Okay.
His respirator settled down a bit.
Are you happy if I pull off, mate?
Great, thank you.
No worries. The neighbour did say he'd had previous presentations of like psychosis type behaviour where he's done this sort of thing in the past, but she can't recall him ever going to the hospital for it.
Yep.
Just every now and then he kind of presents a little bit off and confused and saying weird things.
Yeah, okay.
Yeah.
With mental health, it's a significant portion of Ambulance Victoria's workload. And, we hate seeing people, in emotional and mental health distress. So, no one should do it alone. And reaching out to your GPs, your friends, your family should be the first instance. When you're starting to feel a bit unwell, is to seek some additional help. And it stops people from getting to the point of either requiring an ambulance or having an acute episode that they're unable to control.
There we go.
The patient will now be treated by a team of mental health professionals until it's safe for him to return home.
Just up to the left there, Nate. All good. You're okay.
What was your name? Helen. Thanks, Helen.
While car accident victim Helen has finally remembered her name, it's critical, risky, and two Micah paramedics get her to the Royal Melbourne Hospital quickly.
What's the last thing you remember today?
I don't know.
You were driving. Do you remember where you were going?
No.
How old are you?
I don't know.
You don't know? Okay. It's okay if you can't remember.
The Micah paramedics are asking these questions because they need to know where she is in her cognitive state at the moment. Has she fully recovered or is she still confused? Is this just postictal or is it more serious than what we think?
Helen, have you ever had a seizure before?
Seizure?
Yeah. Do you have epilepsy? Do you take any regular medicines?
No.
No.
Probably the number one cause of seizures is epilepsy. A lot of people have epilepsy and are medicated for it, but there's other causes of seizures. It could be a bleed on the brain, could be a brain tumour. I kind of hope for her that it's an epileptic seizure because they are better controlled with medication and you can live a full normal life with epilepsy, whereas a bleed on the brain and brain tumour are life-threatening conditions.
Do you live by yourself?
No.
No? Do you have kids?
Yep.
Yep. How many kids do you have? Don't know?
No.
That's okay. Have you got staffies?
Yes.
Yeah. What are their names?
Billy and Fred.
Excellent. They're beautiful puppy dogs. So we're here at the Royal Melbourne. What we're going to do is we're going to wander in now, okay? You just stay back and relax, okay? Gavin and I'll take good care of you, all right?
All right.
You're okay though, you're safe? But you've just had a bit of a car accident. Okay?
Fine?
Yeah. Relax.
Okay.
Okay? Here's Gav. He's just going to open up the doors for you. Here you go, mate. Yeah, mate.
Now that we've arrived at the Royal Melbourne, the team will be ready to take Helen into a resus cubicle to conduct further investigations.
Emergency services. Okay, tell me exactly what's happened.
My mother's feeling numb in the face. She can't speak. She's slurring her words.
Okay.
A call's come through from Melbourne's southeast, where a worried son fears his mother may be having a stroke.
Is she awake?
Yes, she is.
Is she breathing?
Yes, she is.
Is she completely alert?
Yeah, she is.
Has she ever had a stroke before?
She had a mini stroke before, yeah.
Okay, an ambulance is being sent.
Thanks so much.
RC139 received code 1.
Paramedic besties, Mike and Eamon, have just clocked on for the night shift and are close by for the case.
It's clear.
1, 2, 3, clear, lads.
Thank you.
All right, we're going to 64-year-old female who's got facial numbness and slurring her speech.
Okay. Sounds like a stroke.
I mean, it looks like a duck thus far.
If this is a stroke, it's a time-critical emergency. Eamon and I are worried because anything including facial numbness, slurred speech or arm weakness are indicative to us that this could be a stroke.
Emergency services. One of our staff has fainted in the toilet. Is currently unconscious.
The emergency call about an unconscious patient is immediately dispatched to Micah paramedics Simon and Michaela.
Just to confirm, is he awake? No, he's unresponsive to sound. Is he breathing? He is breathing.
His breathing is normal, but he's unconscious.
So we're really worried as to what's actually happening with this patient. So we want to get there as quickly as we can so we can work out what's going on.
Has he had some type of intracranial event for some reason?
My main concern is that it could be his brain, it could be his heart, or it could be drug-related.
Any chance of getting back up for this?
We call for backup because the patient is young and unconscious and we might need all the hands we can get.
Hello. He's non-responsive at the moment.
The patient is 21-year-old staff member Camille, and his worried colleagues say he's now been unresponsive for over 20 minutes.
When we walk in, we find our patient unconscious, lying on the floor in the bathroom, and he doesn't look good.
Camille? Camille?
We're 2.7 kilometres.
And go left on Foster.
Correct.
Like follow this, yeah.
We're very close to it.
Mike and Eamon are now a minute away from the home of their suspected stroke patient.
So, if it is a stroke, Monash?
Yeah.
If you'll need neuro, time is brain.
Time is tissue. I love that.
We say with stroke, time is tissue, meaning that for every minute the brain's not getting the oxygen and nutrients it needs, the brain is dying. We need to get there quickly.
Well, mate, I guess it's just go through our stroke protocol and rule it in or rule it out, and if it's not, well, what is it? That one's got people out the front.
All right. Oh, there are so many cars here.
Hello, mate. How are you? Your grandmother? Your mum? Your mum. OK. My name's Eamon. All right, that there's Mike.
Hello, sir.
Hello. What's your name? Rozdoiga. What's happened, darling?
She don't speak English.
OK, you help me. What's been happening, sir?
It just happened, can't talk, that's all.
OK. When did this start?
1 hour ago.
OK. 1 hour ago.
Radoika looks a little bit vacant, a little bit dazed and confused. Her husband and son look really, really concerned. So we have to try and work out what's happening.
Has she been able to form any words, or are they...
She speaks. She was a little bit better.
So it's slurred sort of speech?
She was a little bit better and start again a little bit again, can't talk.
I understand.
She's had a previous stroke in the past.
Gotcha. And did that present somewhat similar?
Yeah.
Given that she's had a stroke, in the past, Radoika's history is a red flag about what's going on.
And aside from the speech difficulties, have we noticed any other problems, any sort of difficulty walking, or have we noticed... Oh, crap, there you are. Hello. Can you just get her to speak a few words for me? I just want to hear her speaking. Ask her what she did today.
Start clean my house.
You cleaned your house?
Yeah.
What else did you do?
One of the key things we look at when it comes to a stroke is speech. Not only are we looking for slurred speech, but we're looking for how well she's forming those words. When the patient doesn't speak English, that makes it 10 times harder.
All right, very good. What I want you to do is reach up, squeeze my fingers really hard. Perfect. Now pull me towards you. Pull. Good. Now push. Push. Very good. Now, I want you to hold your arms out in front of you like this for me. Count to 10.
Even though Radoika is passing some of the cognitive tests for stroke, Eamon continues through all the physical tests.
Can you raise your eyebrows like this? Give me a big smile. Big smile. Have a look, Foxy. I mean, on that, you...
Smile. Show me your teeth. Oh, yeah. She's got an obvious right side facial tip, mate.
Okay.
I agree.
It's not until I asked Radoika to give me a big smile that I noticed the right side of her face has some pretty significant weakness going on. This immediately tells me that Radoika's having a stroke.
Do you maybe want to gather her a bit of a bag for the hospital? We're going to take her there, OK?
My mum is my heart. She's my rock. She means everything to me. My concern at this moment is I'm going to lose my mum.
So we're all in the loop. What I'm going to do is we'll take her up to Monash Hospital in Clayton. We'll get her up there quickly so they can do a CT scan of her brain. The neurologist will review it and they'll work out how they can best help you.
I really don't know what's going to happen with Radoika.
We'll take you up to the hospital. Let's head outside, all right?
She is having a stroke, and if she doesn't receive timely treatment, the damage can be catastrophic and irreversible. Or worse yet, she could die.
Camille, can you open your eyes?
At a business in Melbourne's southeast, Simon and Michaela are trying to work out why 21-year-old Camille has collapsed at work.
Camille,
We check whether he's breathing, which he is, and we also check that he's got a pulse, which he does have one, which means he's not in cardiac arrest, but he still is unconscious at this point. So right now, other than the fact that he's collapsed in a bathroom, we don't actually know what's going on. So we need to do our assessment and we need to gain some history of what's actually happened today to try and piece together the puzzle.
36.4.
5.0.
Okay.
Camille's temperature, blood pressure and blood sugar levels come back normal.
Why is Camille not waking up and what is going on today?
Open your eyes, mate. We know you can hear us. Okay, we know you feel not well, but we need to talk to you, okay?
Can't be very comfortable sitting on the ground here, mate.
Open your eyes.
Okay, open your eyes.
Camille, open your eyes. The ambulance is here.
He's still not responding normally, so we're just wondering, is Camille maybe a little bit confused after his collapse?
Open your eyes. It's ambulance.
What's wrong? You're on the floor at work.
Hello.
What's happened?
Can you talk to us? I'm Simon. I've got Michaela here.
Hello.
Okay.
We're from the ambulance. How old are you? How old are you?
Even though his eyes are open, he's still not talking to me. I'm having difficulty getting a history, and there is a lot of unknowns.
Okay, let's try it together. Ready? Roll over.
Up we go.
Sit up.
Sit up, you can do it. I'll just stand behind you and keep you upright.
Being in such an awkward position, it's vital that we get him up off the floor and onto the stretcher so we can assess him properly.
If you go onto your knees.
Good on you, buddy. Good work.
I'm comfortable Camille can get up on his own. I think that he's probably a little bit shocked, a little bit confused, so we just need to encourage him to do so.
Keep walking to the bed.
You hold on to me. Good, excellent. Thank you.
Thank you.
Camille's colleagues say he's had the sniffles, so they test for COVID as a possible cause of his collapse.
So Camille's test comes back negative, so for now we can rule COVID out of the equation.
Have you ever fainted before? What happened today? Do you remember? All right. You've been working a lot lately?
Yeah.
Okay.
I was bleeding first because of bloody nose at all. I have asthma.
Oh, okay.
Maybe I thought my sinus is kicking in, so maybe that's why.
Maybe that's why.
Am I gonna be okay?
Yeah, you'll be okay. Yeah, you'll be okay. You'll be fine. We'll look after you, okay?
Thank you.
We've ruled out all the major things like hypoglycemic episode or that his heart's not working properly. That's not what's going on today, but it's still important to get Camille seen by a doctor and have some tests done so they can work out exactly what's happened.
I'm not sure what's happened today. I'm not really sure, but we will get to the bottom of it with the doctors and nurses here. They can do some tests and work it all out, okay?
It's really difficult to know exactly what's gone on with Camille today, but he has told me that he's run down, he's tired, and he's actually unwell with some type of illness. So this all could have contributed to what's happened today.
At hospital, they'll do a set of bloods to check for infection. They'll do a couple of ECGs and they'll give him a period of observation to see how he progresses.
Radoika, swing your feet up.
Mike and Eamon are still concerned that 64-year-old Radoika is having a stroke.
We'll just get you all plugged in and covered up, and Eamon's going to take really good care of you. I'm just going to borrow your arm.
Yeah, I'll be there, Mama, don't worry.
Radoika is acutely aware that she's having a stroke. She doesn't know what the future holds for her. You'd almost say doesn't look like a stroke until she does the smile, really.
Yeah.
Like, at rest, doesn't appear to have any sort of facial drift.
Arms are good, and speech is a bit hard to tell with the accent. Sounds all right.
But like
She's saying it feels abnormal.
it must be a really terrifying time for Radoika. All I can do is reassure her and get her to the best hospital possible.
All right, Radoika, don't stress too much, okay? Because at the moment, all the other things look okay.
So we are going to head off, but she's okay. You've done a really good thing, all right? You've done a really good job. She can be all right.
This has got to be incredibly scary for Radoika's family. They're probably thinking the worst, that this could be the last time they say goodbye to their loved one.
You happy to start cruising?
Yeah, mate, just gently, and we'll get underway.
Sounds very, very reasonable to me.
And just a little bit of warmer air back here, mate.
Rog.
Still have problem with your speaking? It still feels a bit funny?
Yes.
Yeah. And you have some numbness on that right side, yes?
Yeah.
Smile again. Yeah, I gotcha. If any new problem, anything else, you tell me, okay?
Yeah.
Tell me straight away.
We've established pretty clearly that Radoika is having a stroke.
Little scratch.
It's important now that whilst we're on our way to the hospital, I get an IV into her arm so she can receive contrast dye at the hospital and identify what sort of stroke it is that she's having.
How many children do you have?
2 boys.
2 boys. Are they good boys?
Yeah, it's very good boys.
Any grandchildren yet?
Yeah, one.
Wow, you're a grandma.
Yeah.
What do your grandchildren call you? They call you Lula?
Luna.
Luna.
Yeah.
Ah, that's nice. Sounds like the moon. All right, we're nearly at the hospital. We'll take you inside. The nurses and the doctors, they will all talk to you and assess you and find out what's going on exactly. And we'll get you through to the scanner for the CT scan for your brain.
All right. Beautiful.
Was he a good driver?
Yeah.
Oh, was that a compliment? Thank you.
You're the first person that's ever said that.
Yeah. Did you just say she's the first person to ever say that?
Yep.
Because it's not a lie, but I also don't like it. All right, my dear. It's a little bit cold. We'll just get you out into the hospital.
We've done everything that we can do, getting Radoika to hospital quickly, to the right hospital and the right services. But there's no guarantees. She could have permanent disabilities, and I'm really not sure how she's going to turn out.
Just lay back, it's all good.
55-year-old Helen was driving home from a dog show with her beloved Staffordshire Bull Terriers when she suffered a seizure, crossing a number of lanes of traffic, launching her car onto rocks.
Okay, I'll loosen it for you, sweetie. I'll loosen it.
It was a miracle she survived the crash, but the paramedics wanted to get her to hospital quickly to find out what was happening in her brain.
Ready?
Yeah, very, very, very gentle, code 1.
In the emergency room, Helen suffered 2 more seizures. 2 months on...
Oh, here's Mum.
And with her son and her beloved canines by her side, life is slowly returning to normal for Helen.
How are you feeling?
Yeah, I'm okay. Hey, how are you guys? At this time, I have been able to walk just one dog, and then my son James helps me with Fred, and we're able to go on walks together.
You're a good girl, Billy, aren't you? Yeah.
In the near future, I'll be able to get back to walking them by myself.
How's the back feeling?
Yeah, it's not too bad.
Yep.
Hopefully soon I'll be able to take both of them.
Helen has been diagnosed with epilepsy and has severe back pain after crushing her vertebrae in the crash. But she knows it could have been far worse.
I definitely think that someone was looking down at me that day. It is a miracle that I didn't injure somebody else or kill myself and the dogs. I've had another chance at life, that's for sure.
Camille, open your eyes.
Okay, open your eyes.
21-year-old Camille gave his colleagues the fright of their lives when he was found unconscious and unresponsive in the staff bathroom at work.
Sit up.
Sit up, you can do it. I'll just stand behind you and keep you upright.
After spending a few hours in hospital for further tests and observation, he was sent home to rest.
You've been working a lot lately?
Doctors put his unexpected collapse down to a combination of fasting during the day for Ramadan, lack of sleep, stress, and being run down.
Okay, you help me. What's been happening, sir?
Just helping can't talk, that's all.
Okay.
It's been 3 weeks since a quiet night at home went horribly wrong for 64-year-old Serbian grandmother Radojka.
Give me a big smile.
Smile. Show me your teeth. Oh, yeah. She's got an obvious right side facial too, mate.
Radojka, we'll take you up to the hospital. Let's head outside, all right?
After experiencing a stroke 5 years earlier, her family feared the worst.
I'm just going to borrow your arm.
Yeah, I'll be there, don't worry.
Tests confirmed Radojka was suffering a stroke, but a clot-busting drug was administered straight away. And after a short hospital stay, she's back doing what she loves.
So Mum's been back for roughly 3 weeks now. She's back in the garden. She was in the garden actually the next day that she came back from the hospital. So she's in good spirits. She's smiling, she's happy. She's a joy, she's a joy.
It's good to come outside a little bit, get some fresh air in us. How do you feel today? You feeling better?
That's good.
Good?
Much better.
Much better.
Yeah.
Feeling strong? Young?
Yeah.
Yeah, young.
Thanks to the fast action of her family and the paramedics, Radojka is expected to make a full recovery.
I am beyond grateful is an understatement for the paramedics crew that were there on time, super quick, super professional. I have so much love and respect for them.
She's really okay. She's beautiful, really good woman, hard-working woman and really good woman. We look after her, she look after us, and no problem.
Dad was super terrified at the moment, but I can see him, he's smiling, he's happy to have his love of his life next to him. So it is amazing to see my parents both happy and smiling.